My name is Raquel Maison Jeffers, and I am the Senior Program Officer from the Nicholson Foundation in New Jersey. Thank you for joining us for this Project ECHO, Maternal Child Health, and Opiate Use Disorder COVID-19 discussion. I'm your facilitator for today's discussion, and I'm particularly delighted to be with you today. And I'm inspired by the certainty that through collaboration, we can help each other and the moms and babies and toddlers and preschoolers that we serve. At this point, for some of us, this is the 8th time we're gathering to discuss MCH and COVID-19. ECHO is a forum that is designed for you to be able to ask questions of experts in a given field. We have a large number of attendees on these calls, so we're asking that you write in comments and questions throughout the session. We also have questions that some of you submitted when you registered. We've intentionally abbreviated our introductory comments and presentation so that we can get to as many of your concerns and questions as possible in the hour. Chris Scalise, who has been a great sponsor and supporter of the Project ECHO MCH sessions, is the manager of the Women and Families Unit at the Division for Mental Health and Addiction Services at the New Jersey Department of Human Services, and she's on the line with us today. Thanks for joining us, Chris, and for remaining with us for the Q&A at the end of the session. Now, just a quick housekeeping comment. If you've not already registered, we ask that you register using the link in the chat. The Q&A section for writing question appears at the bottom of your screens. This session is being recorded and it will be distributed after the session, including any links and resources shared during the presentation. Unfortunately, we're unable to offer CEUs for this COVID-19 series, but we encourage you to sign up for our regular MCH OUD ECHO, which is scheduled to start on June 15th, which is actually next Monday. CEU credits will be given to participants who attend regular ECHO sessions. Finally, if you're viewing this recording at a later time, please realize that this might not be the most current information at the time you're viewing it because the situation continues to change. Your most up-to-date source is to check the COVID-19 pages of the websites for the New Jersey Department of Health, Human Services, the CDC, and NJ.gov, which are also provided on the Rutgers Project ECHO COVID-19 webpage. Okay, today we have one presentation and then we've organized a panel of pediatricians for an open Q&A session to address as many of the COVID-specific pediatric questions that have surfaced over the last few weeks. The topic of today's session is managing patient care through COVID-19. Our first speaker is Dr. Carrie Lagosa-Muserel, JD. Carrie is the Executive Director at the Greater Newark Healthcare Coalition, and she will be speaking on fostering community health and well-being in the wake of COVID-19. Carrie, I believe you should be unmuted.
Yeah, great. Can you hear me, Raquel?
I can, great.
Thank you so much, everyone. And also, it looks like I'm appearing as our system administrator, Mary Long, so forgive me if that's the case, but I am indeed Carrie Lagosa-Muserel, and I'm glad to be here, and also grateful. As of this morning, it looked like a few of my Greater Newark Healthcare Coalition colleagues were going to be able to join as well to listen in and learn with us. So Nikki St. Germain, Brenda Williams, and Charisse Carrion, with whom I cannot otherwise do this work without them. So glad they're here. So without further ado, I have a few slides that I'll be tag teaming with the Project ECHO staff to advance. I'll just say next when I'm ready to move on. I'd like to give you a little bit of background. So in New Jersey, we are fortunate that there was legislation signed into law by Governor Murphy in January of 2020 that created a structure called regional health hubs. And there are 4 founding regional health hubs. There is the Greater Newark Healthcare Coalition in the north, where we are located, our nonprofit. And then we are joined with sister coalitions, the Trenton Health Team, the Health Coalition of Passaic County that is focused on Patterson, and the Camden Coalition. And at the end of my presentation, I'll be sharing their contact information so that if you are located in their geographies, you have an opportunity to connect with them if you have not already gotten to know them. So these regional health hubs and these founding regional health hubs specifically, we're not meant to be the only ones in New Jersey, but we are the beginning of this framework. We have a few functions. One is to operate or utilize a regional health information exchange to support data interoperability and sharing. We are meant as nonprofits, which we all are, to convene multi-sector partners around the region and facilitate priority initiatives, both locally and those that might originate with the state so that they can best be implemented locally. We have a role in thinking through and facilitating care coordination for high-need populations. And to allow us to do that, we have the benefit of receiving Medicaid claims data for our catchment areas so that we can understand the local populations rooted in data and then think through ways we might be able to improve their health outcomes. We also operate as a clinical redesign specialist. So even beyond care coordination, we know that there are other systems, issues that might need thinking through and piloting or changing with providers and payers and the state. So we serve as that partner. And related to all of this, we are looked to as local experts and conduits for state priorities. And when I say we are the local experts, please don't understand me narrowly. We as nonprofits have a degree of expertise, and then because we can convene multi-sector partners, we spend a lot of time identifying local experts and bringing people into conversations so that we have the most comprehensive understanding of topics, much like we're doing today, and we're glad to be with you. So next, please. Specific to Greater Newark Healthcare Coalition, we've defined our vision as health equity for residents of Greater Newark, and our mission statement as working collaboratively to improve systems and community and individual conditions necessary for optimal health and well-being. And our core functions, as I just went through from the enabling legislation, a lot of emphasis on the neutrality of ourselves as conveners. And when we say multi-sector, we think of clinical partners and we think of non-clinical partners. Our board, just to give you a sense, is made up of high-level decision makers from the hospitals, academia, advocacy groups, managed care, and even city and state government in ex officio capacities. So we do enjoy that level of access, which is very helpful. And then beyond the board, we have initiatives, which I'll touch on momentarily, that bring us into communion with the very trusted community partners in the faith sector, in the neighborhoods that we serve, and otherwise through our community-based organizational partners and individual residents who live in our communities. We do facilitate data sharing and interoperability. Each of the 4 regional health hubs has a common data platform known as Care Evolution that we'd be happy to talk about with you in more detail, as we move forward as partners. We do test innovative strategies, and we bring what we learn from the local regions into the system conversation so we can inform healthcare policy and advocacy. Next. Our strategies have coalesced around a few priority approaches. One being maternal and child health, where we are one of 6 grantees in New Jersey with the New Jersey Department of Health's multi-year Healthy Women, Healthy Families initiative. And the goals of that, for those of you who might not be as familiar, include improving Black infant health, so reducing Black infant mortality specifically as a measure, but improving Black infant health overall, and Black women's health, so African non-Hispanic, African American non-Hispanic, in particular because there are glaring health disparities. I know this audience is well familiar with that, but it bears repeating. And we have various strategies under that include community health worker, convening community advisory board, fatherhood engagement, and other strategies. But then related, but not exactly the same, is a Merck for Mothers Safer Childbirth Cities initiative, where we, along with the Camden Coalition, endeavor to reduce severe maternal morbidity and mortality through a host of strategies that include building out that platform I mentioned as a surveillance system, so that we have a better understanding of severe maternal morbidity and mortality and can reduce it, quite frankly, and eliminate it as an overall goal. Otherwise, beyond that work, we have faith-based work that engages the faith-based organizations in our area to prevent and better manage chronic diseases. And we started with those related to obesity. That is a New Jersey Department of Health partnership with Trenton and Camden and Patterson as well. And then last, but certainly not least, Newark and Camden are grateful to be part of what's called the Promise Neighborhoods. That's a federal Department of Education effort that is embedded in the local neighborhoods in Camden and Newark, where we recognize schools as a trusted anchor within the community and at the nucleus of child achievement and family well-being, and that can't happen in a vacuum. So that anchor partners such as we in Newark as the health partner, housing partners, employment partners, others all have to be part of the strategies to reach the goals that we have for college to career readiness and family well-being. Next. So in the wake of COVID, as you can imagine, these various partners have expressed to us ways that they would appreciate our help. So I'm highlighting a few to give you a flavor of the work we've been doing and also to inspire your thinking for additional ways we might work together, either locally in the greater Newark area or with your respective regional health hubs or otherwise. One is through our clinical partners at University Hospital, Newark Beth Israel, and Clara Moss, who are our local labor and delivery hospitals. There was a need identified to better support women's transition to telehealth. And so we worked together to apply for a New Jersey Pandemic Relief Fund grant to source supplies that were identified for what we're calling a new mom kit. And the new mom kit is a diaper bag or a tote bag that includes blood pressure cuff, thermometer, digital thermometer, cloth mask, and educational materials that were either refreshed to be more culturally sensitive and attuned to literacy levels, or created anew around topics such as how to monitor fetal kick counts at home, how to monitor your blood pressure, how to take your temperature and your baby's temperature, COVID-19 discharge planning so that women who deliver at the hospital have something they could refer back to when they are home on how to keep themselves, their families, and their environments as healthy as possible in the wake of COVID. And we also partnered with the Preeclampsia Foundation to include some important signs and symptoms about preeclampsia and, as we know, post-eclampsia that can happen in those 42 days or beyond, that it's important for women to know if they're transitioning to telehealth, when to seek care at their local provider and what they can be doing at home and attuned to. So I'll go into those just another minute on the next slide, but wanted you to just know that on the community engagement, some of our strategies include breaking down social isolation and really fostering connectedness, because this is a very challenging time, as we know, for everybody. So my Healthy Women, Healthy Families colleagues have been with their team of community health workers reaching out by telephone to check on the participants in our initiative to see what their needs might be and how we can support them. Also putting together programming around fatherhood engagement virtually, putting together Dance With Me, Mommy, or Caregiver and Child, social bonding and family bonding opportunities, building block educational and social emotional health opportunities. Those have been critically important. And we've shifted our community advisory board and our other meetings to a virtual platform. We've also even managed to launch some of these things anew in COVID, which is pretty remarkable and a testament to the level of need and the level of work. Beyond those two, we are serving the State Department of Health and the Governor's Office and our partners at Medicaid, thinking through the recovery and response elements of community health worker supports and contact tracing. Those will be unfolding in the coming weeks as details emerge through different vendor contracts at the state level and other planning that is happening as we speak. And then the last two I just want to touch on. We have a social service referral platform known as NowPow, and in Camden they have a companion platform known as Aunt Bertha. So we are working with those technology vendors to best meet the needs of our local communities. And those include community-based partners and clinical partners, so we could screen for social service need and then help individuals navigate through the community resources most efficiently and effectively. And then prioritizing health concerns as they come up. I'll just mention there, because I know you're going into Q&A with pediatricians in a moment. We are concerned about the drop in vaccine rates as a health concern that's come up. And we issued a letter to the governor's office and to legislators advocating through our legal and advocacy committee on a number of things related to vaccines. And one of those is a local effort we are working on the ground on, which is a vaccine catch-up effort with our local health department, and we're exploring if it might be countywide to figure out with our clinical and community partners the best way to let families know how important vaccines are and give them easy access to vaccines for their children so that we catch up on the immunization rates that have dipped during COVID. Next. I touched on this already, but just there was some coverage in the news, which is always nice when our issues can get some airtime. That 1,000 kits were being deployed through our hospitals to women in the third trimester and or at delivery. And we do have up on your screen the newarkmom.org URL, which we ramped up in the wake of COVID so that the educational materials we worked on with artists and the Rutgers School of Public Health could be readily available to you electronically for broad distribution to your networks. Next. And then I did mention earlier on that there are regional health hubs throughout the state, and I really encourage you all to look up their websites, engage with them if you haven't, and then any questions beyond today that come up, you can always reach out to me, and I'd be happy to think through either connecting you or helping you answer the question myself. So that ends my overview, but I encourage anyone who has questions, if time permits, to please share them now. And I realize I might not be on video, which I am so sorry if that happened. I don't know if it'll be worse to try to mess with it at this point.
Thank you, Carrie. That was a really wonderful presentation. It's amazing to hear how well you all have responded to the epidemic with very grounded and necessary resources on the ground. Our next group of speakers will be a group. If you have questions for Carrie, please feel free to type them in the Q&A chat box. We're going to keep moving on as well, but we'll definitely double back if people have questions for Carrie. Our next speakers will be a group of pediatricians from various health institutions who will be conducting an open Q&A on COVID and children. So you will have the opportunity to ask questions of the panel of pediatricians. So our panelists include Dr. Shilpa Pai. She's the Director of the Resident Education and Advocacy and Community Health, and she's the co-director for the New Jersey Pediatric Residency and Advocacy Collaboration. She's an AAP District 3 Community Access to Children Health Facilitator, an Associate Professor of Pediatrics at the Department of Pediatrics at the Rutgers Robert Wood Johnson Medical School. We also have Laura Park joining us. She's a behavior Behavioral Medicine Fellow at the Division of Behavioral Medicine at Cooper Medical School at Rowan University. And our third panelist is Dr. Joseph Schwab. He's the Associate Professor for Pediatrics at the Division of General Pediatrics at the Rutgers, New Jersey Medical School. He's a primary care pediatrician at University Hospital and the chair of the Essex Metro Immunization Coalition. Okay, so I'm actually gonna go ahead and kick us off. I'm gonna start with some mental health questions that we received because we've had a lot of mental health questions on the calls about kids, and we really haven't had that expertise on board before. So welcome, Laura. I think most of the questions have really been focused around how parents can manage their own stress and anxiety and help their children manage a stressful time.
Sure.
But why don't we start specifically with how parents can best support their children's mental health during this time?
Sure, and that's a great question. And I think one of the first things that parents can do that's beneficial and we can remind them that's beneficial for their children, is to keep their own mental health concerns in check and just be aware of how they are feeling and what they are experiencing at this time. Anxiety is contagious. So as we sort of navigate things as parents, if we're experiencing that anxiety, we could be sort of passing that along to our children. But it's important to validate our children's feelings when they come to you with concerns. Validate that. Normalize their emotions. So let them know that these are very typical things for them to be feeling right now. Encourage your children to ask questions. So as they're asking you questions, you can then respond in a developmentally appropriate way, as opposed to just sharing information with them that might not be appropriate for them at their level. Always encouraging discussion where they can label their feelings. You can help them label their feelings. For children and teens, a lot of times we don't necessarily have them talk about their feelings. They show us what their feelings are through their behaviors. So that might be a good point if we're noticing those behaviors, to sort of bring that up and label the emotions that they might be feeling that are sort of underlying. Keeping up with a schedule can be important at this time because things are so uncertain. Children are missing their school schedules. Teenagers are missing their school schedules. So sort of implementing some sort of schedule in the home environment can be helpful and provide some certainty to them. Different things, connecting as a family, trying to get some sort of physical activity, get kids up and away from their screens. And lastly, just helping people still connect, helping your children, helping your teens still connect with their social supports and family members they may be missing, because that's a big loss for them right now too.
Yeah, thank you so much, Laura. I think that is fundamental. I'm going to just follow that up with one more question, and then we'll sort of jump around a little bit more. But just really want to address some of the mental health questions because we've gotten a lot of them. So one question is how do you start building a relationship of trust with your patients, either because they've lost touch or they're kind of newly trying to customize themselves to working with you in a telehealth.
Telehealth. Sure, the telehealth can be difficult, and something that as providers we notice as well, and to acknowledge that this can be difficult for you as a provider, and you're inviting people into a different environment than you would. They're either coming into your home environment, coming into your office environment, which wouldn't have been the case before. And so it's difficult for people to connect as well. I think one of the biggest things can be to acknowledge that this is a platform that's very different from what we might usually see. And this can be challenging, and this can be hard to connect. And how are you feeling about this? Also one of the big things that we were just talking about in this time where we are right now is there's an increase in the awareness of social justice issues with the Black Lives Matter movement. The racial differences as well in our therapeutic relationship and the provider-patient relationship, they need to be acknowledged and they need to be addressed and openly discussed, and so that we can sort of see how our patients, how our clients how they're really responding to those things, because you have this extra barrier now where we're communicating through a device, and that can be very, very difficult. But, you know, as far as us as white providers, in terms of this movement, white therapists, we have the responsibility to do our own research, and we need to be doing that now, educating ourselves and learning.
Thank you, Laura. I'm just going to see if Natalie wants to weigh in. I know that it's been a week of really thinking hard about social justice issues and race, and I just wanted to see if Natalie wanted to add anything.
When I was talking to Laura ahead of time, this is, you know, I did bring this issue up. This is the elephant in the room, but the elephant has been there forever. It's just that the therapist now, who is not a minority person, is starting to recognize the elephant in the room because of what's going on in the larger society. So it's an opportunity now to address some barriers to the therapeutic relationship that actually already existed. But were not really recognized fully by the caregiver, and at certain times even for the care receiver, who may have a certain level of anger and mistrust without even really understanding why that is true. All right.
Right.
Thank you. Okay, I'm going to see if we can switch maybe over to Dr. Schwab. And there were a lot of questions about the type of precautions that parents can take to protect their children's health before they return to school. I think this might pick up on some of the immunization issues that Carrie was raising as well.
Thank you, and I apologize for not having the video available, but I'm thankful for being invited to share with you on these topics. I think we're all hopeful that healthy children especially can get back to school safely, and I'm very appreciative of your bringing up vaccines. I think that's one of the major issues that we are worried about as pediatricians, is having our children return to school now under-vaccinated, because either they're afraid to come into the clinic, or they're afraid of vaccines, or the clinics or practices are not open and able to handle the volume to get children caught up. And so we're exploring ways to kind of maximize vaccine visits this summer so that we can get as many kids appropriately vaccinated as we can. We don't want a second epidemic of something like measles popping up in the midst of maybe a second wave of COVID. We're worried about combining flu in the fall with COVID. And so vaccines are one of the most important ways we can help. We also encourage families to start thinking about what kinds of school policies are going to be in place when schools do reopen. And we can think of lots of ways that might be undertaken by different schools to get them ready to have children go there safely. Things like modified schedules, social distancing within the school, avoiding larger groups like lunchrooms and places like that, using masks, and taking temperatures may all be on the menu of things that schools might choose to do, among other things, to keep the environment as safe as possible. And so parents should really be asking questions and participating with their schools in terms of getting ready for that. As far as health goes, I think it's important for us not to forget that normal routine pediatric care is important. So they should come in for their physicals, they should get their sports clearances in preparation for when sports might begin again as well. And then anyone with any kind of underlying medical condition is going to have a conversation with their own doctor about when it would be safe for them to return and under what conditions, or if they might need to stay home and participate from a distance. And I would assume many schools are going to be offering some kind of a hybrid where they'll have some courses online or some online offerings, and then have some, or hopefully the majority of the patients able to come into the school.
Thank you, Dr. Schwab. I just want to follow up on one point that you began to talk about, and that's kind of regular office visits. We've noticed both for prenatal visits for mom and also pediatric visits, we're not seeing a lot of families accessing care in the office. And I'm just wondering if you can talk a little bit about the office procedures that are underway to protect families and what other ways that care is being provided to make sure that kids are up to date and being seen and getting the care they need.
Yeah, thank you. That's been kind of a difficult thing for us as pediatricians adapting to the new environment. Not only are some of our colleagues wary about opening their offices and exposing their staffs or themselves to infection, but also many of our families are reluctant to come in because they're afraid to come to a medical environment where they assume they might come into contact and where they might come into contact with sick people, some of whom might be positive for COVID. And so there's been a few things we've done to try to help that along. Someone earlier mentioned telemedicine, and that was something that we've used a lot of in our practice, and it was a steep learning curve as we kind of just jumped right in and tried to learn how to do it on the fly. But it actually, in our practice, ended up working out very well, and we've got a lot of families who like the telemedicine format, especially from some of the sick visits that are simpler. And we're finding that we may end up continuing that even after things calm down. We've tried to maintain our office, and we've kept our office open here in Newark since for the entire pandemic. So at first we were seeing only newborns in the very first days after they were discharged, because they were being discharged very quickly from the hospital, sometimes within a day. And so they had to come in to be seen. And then we were doing the under ones, and now we're trying to get up to date with our 4-year-olds. Some of the things we do is we've limited office visits per day so that there's fewer patients coming into the office at any one time, so that there's less risk of being exposed to other families. We try to keep our waiting room as empty as possible so that when patients come in, they go directly into a room. Some of the things that used to be done at the front desk, like registration, are now done in the room instead. Since we're in a medical building, patients as they come in are questioned at the door about symptoms and potential exposures that they may have had to COVID, and they're given a mask and their temperature is taken before they even come up to the office. And then they're again asked the same questions by our staff once they get into the office. We've done things like ask only one family member to come with each patient, and that family member realize that they shouldn't be sick or have been exposed to COVID when they're accompanying their family member in to the visit. And then we try to keep the clinic environment as clean as possible. So we're doing extra cleaning after each patient, wiping down all surfaces, and really trying to make the families as comfortable as possible when they come in, that they feel safe and they feel cared for, and they're not going to be risking exposure.
Thank you very much, Dr. Schwab. I think that those kinds of actual procedures and reassurances are really important right now. Dr. Pai, I'm sorry, I know you're seeing patients and juggling a lot of things. I'm just wondering if we can talk. There are lots of questions about newborns, horizontal transmission. What do we know about that? What about newborns who are at home and allowing visitation? Whether newborn babies are born with antibodies for COVID-19. So just maybe you could address some of what we know right now about horizontal transmissions and how do we protect newborns.
So that's a really great question. I know there's a lot of studies being done, as you mentioned, but things keep changing. So what we do know right now, so I think in March of 2020, there was a study that came out of China, which basically looked at about only 6 moms at that time with confirmed testing, COVID testing, and they looked at their antibodies, and they found that it was actually elevated in the babies. Antibodies were elevated in the babies, of 5 of those babies. But the question is, those antibodies can be transferred through the placenta. Sorry, my resident's gone, so now I can take this off. The antibodies are transferred through the placenta, so that could be mom's antibodies. But really, the significance of these findings is really still questionable, because we don't really know what that means, because the amount of antibodies can sometimes decline naturally anyway after birth, when they're expected to rise if the child was actually infected while in the womb. So, or it could just be a false positive. So we really don't have a good understanding about when these babies are positive for antibodies, what kind of protection that means. And to go to your question, Raquel, about asking about babies being visited by family members. So this is a really, tough time, because it is hard enough, delivering a baby by yourself in that delivery room, but to go home without those supports that you may usually have gotten from grandmothers, aunts, and uncles, it is a new time. But as always, our initial or our main concern is just to make sure that the baby's okay. So what I would recommend is social distancing. It really remains the best strategy for limiting the risk of any kind of infection for the new babies. So people who don't live with the family or don't live with the mom really shouldn't come to see the baby until COVID-19 pandemic is pretty much gone down. That means that anyone who is around the baby, regardless, even in the same household, so caretakers, siblings, really important, washing hands frequently as possible, and really taking extra special care to wash their hands before they hold the newborn or touch the newborn. And if someone has COVID-19 newborn symptoms and they live in the same household as a newborn, really got to isolate that person from the baby as much as possible. And I'm seeing a lot of, through the window visits for newborns, which is kind of how this basically how we're treating the elderly too, is that we want to protect them as much as possible. So that means just really limiting interactions.
Thank you, Dr. Pai. I'm going to jump to the next stage of development, the K through 5 stage, or sort of the toddler stage. How can we help young kids kind of get back to school, given the fact that they might be fearful and anxious about being sick? Laura, feel free to chime in too. And what precautions do we need to take for young kids? What about the environment, safety measures for the daycare facilities to reopen? And then we actually also did receive, I'm sorry to throw, but I'm trying to bunch the questions so we can get to as many as possible. Kids who are special needs kids, who might be in a child care facility where there are they might have more incidents of biting or kicking or scratching. Like, how do we manage that? And not easy questions, I'm sorry.
The hard ones. But it is a really good question. I think it's something on the top of everyone's minds right now. And how do we reopen? How do we reopen safely? So to begin with, any proposal to reopen the schools in September really needs to be done hand in hand with the Departments of Health and any kind of regulations we're getting from the state. So that means, what does that mean? Testing of students. It does mean appropriate social distancing. So we're talking about, in the younger kids, especially talking about not having assemblies anymore. The older kids thinking about whether or not what fall sports are safe to play. I think another thing that has to be important before you open up any of the schools is having a good system or protocol in place. So for example, cleaning and disinfecting the school buildings, so the classrooms, especially the water and any kind of restroom facilities. And it has to be done at least once a day. So particularly surfaces that are touched often. So we can just imagine in the younger kids' school settings. So doorknobs, desks, railings, lunch tables, sports equipment, door and window handles. So all those things that are touched often, there needs to be some type of system in place before kids enter, but how are you going to keep it as clean as possible? And then implementing social distancing. So this is going to depend on each school district, I believe, or whether or not it's coming from the NJEA. But how to implement social distancing, whether it's going to be staggered start times, is it going to be A day, B days? Again, tracking about whether or not assemblies are going to be safe, games are going to be safe. And just how do we separate the desks at school? So how do kids sit together safely at school, and modeling this creative space? And to address the question about anxiety, I think it's a really great point. I would say one of the most important things is the schools to really learn how to listen to their students' concerns and answer these questions. I think forums like this are great, but I've done forums like this I just did it for a few of our school districts. I did it for the Franklin Public School District and the New Brunswick School District, because I think it's important for children to have a voice and ask the questions that they have on their mind. Because as parents, we might not know, or our kids might not think that we know the answer. So it's important that we voice those to the teachers and to our school administrators. That being said, I think it's good to empower our students, no matter what the age, even the kindergartners, that they can do a lot on their own to stay safe and to be healthy and keep others safe. So when we talk about social distancing, I think it's important to talk about good health behaviors, so hand washing, sneezing into your elbow or coughing into your elbow, washing your hands. But I also think it's important to educate them about stigma, so and prevent any kind of stigma associated around this virus specifically. And people automatically, I think, find out someone was infected, that there's an automatic negative stigma attached to that. So really, education is huge. I'd also encourage our partners in education to talk about how to build like their students' voice or their agency per se. So in sense of having the kids learn about public health, promote facts about public health, have them create posters throughout the school that they design, so they take pride in that. But even having them do public service announcements. So over the, I know in my kids' school, they bring a kid in every day over the morning announcements over the intercom. And having the students come and do like a public service announcement on a regular basis, so they feel like they have a voice. Incorporate lessons into science plans. So for example, have science lessons about viruses, obviously age-related, disease transmission, public health issues, the importance of vaccinations. We talked about vaccinations earlier. And I would also say social studies. I know couldn't talk about the history of different epidemics, pandemics. I know one of these forums I did for another school district, they asked me, like, was this the worst pandemic yet? And I went and learned a lot about the bubonic plague, for example. So I think it's really a great way to incorporate that. And finally, media literacy. So a lot of our kids are on social media, but talking about empowering them to how to read through social media critically, knowing what are the most accurate sites to go to. And that being said, the sites that I endorse are the CDC, Center for Disease Control, World Health Organization, and New Jersey Department of Health. Those are the 3 sites that I go to for data, scientific evidence, and valid information. So I would recommend just empowering our kids that way.
Phenomenal. Thank you so much, Dr. Pai. Laura, I don't know if there are things you want to add before I transition us to lots of teen questions. You're on mute.
There we go. Can you hear me now? Perfect. Okay, I was saying that I think that, what Dr. Pai mentioned is incredibly important as far as empowering children and having those open conversations with children. And this can be done at home, this can be done in school, having them be aware of things that they can control. Sometimes with younger children, we do a visual on paper, inside a circle, things we can control, outside the circle, things I can't control. And so empowering them in seeing, okay, these are the things that I can control. I think that my hope is that we'll see school counselors taking a more active role as in schools where, kids maybe used to just go to the school counselor if they were experiencing some distress, but at this point, maybe we'll have school counselors coming into every classroom. This is going to be a normal thing that they'll be doing so that they can implement this as, their mental health is something that can be talked about on a daily basis in every classroom. Maybe we'll have check-ins in each classroom. How are you feeling today? Does anyone have any questions? Is there anything that you're concerned about? Is there anything, what's the biggest worry you have right now? So that we can sort of normalize this, because a lot of times these mental health concerns, anxiety, depression, things like that, it's not normalized. But once we sort of do that, and teachers can kind of take the reins on that, and school counselors, and get in there, and we can normalize and have these kids just having open conversations.
Thank you. That's really helpful. So I'm going to take us back to where we are still now, which is that everything's still closed, more or less. So, and there are still lots of questions about how to support teens at home. How can we help them socialize in a way that is safe? How do we really think about telehealth and group therapy in a way that might be safe to do. Lots of questions about how we can really help support our teens at home, not just teens, but also other kids at home using telehealth and other forms of therapy to address issues of isolation.
Sure, sure. I can start with this one. And so, you know, with teens, developmentally, they seek more independence than our younger children might. So younger children may be okay with staying at home with a parent, and they're enjoying that time. I'm talking, you know, much younger children, but the teens they're seeking that independence. And so this is something that it's suddenly their distance from classmates, from peers. We might see some behaviors from teens. They may be showing us more defiance. They might be showing us some disrespect. There might be some withdrawal. They might be sleeping more than normal. They may be sleeping less than normal. And so underneath of those behaviors that we see, you know, there's a lot of disconnection, there's fear, there's confusion. They may be concerned about their social status at school. So they're not seeing their friends, they're not seeing their partner, their significant other. So all of those things sort of come together. You know, I think sometimes I've had parents ask me, they're concerned about the screen time that their kids have right now at this point, but really, you know, as we've been in the red phase, that's their point of connection. And so even encouraging, you know, safe use of their devices, but encouraging them to gather socially with each other, to talk to their supports, even the chats where you can have a group of friends talking at a time. With socialization, the frequency is going to be more important than the duration. So even frequency of talking to family members, it doesn't have to be for an hour long, but just having that social connection with your supports, whether it's friends or family, is going to be important. The NewJersey.gov website does have, under the Department of Children and Families, there's a youth resource guide, and there are some good resources there with, it discusses mental health, it discusses links for part-time employment once we sort of open up again, ideas for social connections, things like that on there. So that can be something that's good too. But I think, you know, for parents to realize, for the teens especially, that this is their social connection is a big part of their identity. It's a big part for them. It's developmentally appropriate to want to be out and want to be, you know, connecting with their peers. And it's been a big loss for them. And so they're sort of in their own way probably grieving that loss.
I just wanted to open it up to see if Dr. Pai, Dr. Schwab, Dr. Roche have anything else you want to add as you think about teens. Go ahead, Dr.
Well, again, the elephant in the room, a lot of the teens are out now because they're out demonstrating, all right? Yeah. So parents are going to have to, you know, deal with negotiating them leaving the home and going out into large groups and trying to keep them as safe as possible. Social distancing, as you can see on television, is not really something that's working very well, but trying to keep hands clean, faces covered is something that's going fairly well out there, you know, with the demonstrators. So these are largely young people. Many of them are high school students, and you know, they have very, for political reasons, et cetera, left the house, but there also is the great unleashing of being able to get out of the house. And parents have to be aware not only their risk of demonstrating, but they also risk of acquiring, you know, COVID-19 and also bringing it back home with their, you know, advocacy work that they're doing out on the street.
Yeah. Dr. Pai, Dr.
Yeah,
Schwab?
I would also I would also add on that there are ways for teens to seek help if they do need help, and that given like the telehealth, the big positive is that kids can actually talk to therapists, right, via telehealth. And I know at our health center we have, thanks to the Nicholson Foundation, we have behavioral health consultants at our health center, and our health, they've been reaching out proactively to our kids who already have some underlying anxiety or depression, because it is a really difficult time. And we've started doing teen groups too. So we are doing groups now for teenagers to kind of talk about these things. And actually another call I did was with teenagers through the YMCA who are at risk because they have histories of chronic absenteeism. So I did a talk with them, and it was like 6 kids, and it was great because they asked all their questions. Because I've had one kid on that call who hadn't been out of their house in 2 months, which I think is a huge, detriment to their mental health. So one of the things, like, I know there's a lot of information out there on, but letting them know that they can go outside safely. And I think it's really important for our kids to know how to go outside in a safe fashion, maintain their social distancing. And because I feel like, being inside on a screen all day, I know that's kind of part of what it's been, but I can see that kids who are like learn how to take a break from their screen in a healthy way, not go from like their Zoom screen call for school to video games, but instead of a Zoom screen call to a walk outside makes a big difference on kids. So I guess twofold answer is: one, if they can go outside as much as possible in a healthy, safe way, really important. And the second thing is if they need help, reaching out for telehealth, behavioral health counseling.
You're here. Dr. Schwab, anything you would like to add?
Yeah, the thing that comes to mind to me, and that I've always tried to instill in the kids that I see in the office, is a sense of responsibility. And so, as Dr. Roche mentioned, some of these kids are going out and really wanting to be active in terms of speaking up for what they believe in. They participate maybe in some demonstrations or protests. They should also learn to take responsibility for their own family and their actions. And so if they're going to be going out and participating in these things, you don't want them bringing the virus then back to more vulnerable people, like either young babies or older family members that are in the house. And so if they decide to do those things, then when they come home, they need to kind of figure out how they're going to isolate themselves as a contribution to keeping their family safe, and what measures they're going to take. And they have to, be willing, in my opinion, and motivated to participate in some of those measures that we know are going to help limit the spread when they do come back home.
Yeah, thank you, Dr. Schwab. I wanted to turn the conversation a slightly different direction to Natalie, to Dr. Roche, to talk a little bit about a resource guide that she wanted to share with you. As we were talking right before the call started, that a lot of rent is coming due and other bills are coming due for families 3 months into the epidemic. And so there are some important resources that we think families will need. So Dr. Roche, do you want to take it from here?
Yes, I asked that this be put up as a Community Resource Guide 2020. It's really from the Rutgers Cancer Institute of New Jersey. The one I put up is the North Jersey edition, the Newark Resource Guide. I like this because it's English and Spanish, and it also has a consolidation of a lot of resources that people would have to go to a variety of different websites to actually find, from how to keep yourself from getting COVID-19 to what you can do for diagnosis, how you can get support in your home, especially if you become ill, insurance information. So it's not a reinvention of data that's not already out there, but it's really a nice consolidation into a single kind of document of a lot of different information, which I think, for example, this one that's coming up with paid sick leave, what you're entitled to, what you're not entitled to, with the family leave insurance, all kind of things are really consolidated in a very, very nice way. So I just wanted to bring that up. And I also just wanted to say something about minority students and the actual stress that they're under. Even very small children now are saying things like, "Oh, the police are going to kill me." And these are like 4 and 5-year-olds. They're watching TV. Sometimes they're being brought to demonstrations. They're seeing a level of violence out on the street that they may have not, ever experienced before. And we'll talk a lot about the school system, but the school system for minority people is not always a safe place. We look at statistics about disciplinary action, and minority students are disproportionately disciplined. And the idea that you're going to go to school and, talk freely about your emotions in an environment that is not always a safe place for minority students is another one of these many things that we're going to have to address in society. All right, so, I always say that if the minority student comes to school and has a problem, and you go to the dean of discipline and they do not call, this child study team to see if you have a problem. So these kind of things are basic and fundamental within the system, and the children are well aware of it. And therefore, they may be reluctant to really participate fully in these, talk groups or whatever that the schools may put together when school reopens, because they don't always find school to be the safest place for them.
I'm sorry, I just, that's really tough for kids. That's really important perspective, and hard to know
Just
how
add
we.
on to that, Raquel, I just want to also add that a lot of times kids who's labeled as behavioral issues, I think it's important to look at the child and not say like, what's wrong with you? I think, kind of going back to adverse childhood events and thinking of racism as one of those adverse childhood events. But I think it's really important that we look at what happened, right? And I think especially with these protests going on, I think it's even more important, not even more important, it's always been important. But I think now I'm hoping that there's more discussion and dialogue going around, just recognizing behavioral issues doesn't mean that they're a bad kid, that there's something going on, and really kind of digging deeper as healthcare professionals, educational professionals, and really kind of finding out what's going on as opposed to just doing discipline as the first measure.
I'm also wondering,
Dr. Pai, I agree with that. I think go ahead. I was going to say, one of the things that I think is very important too, just like you said, to not say as much what is wrong with you, but what happened to you. So you're kind of approaching the situation in that way. It can totally reframe how we're looking at a child and their behaviors. And the other thing is just to remember that that's how a child a lot of times will talk about their emotions. It's through their behaviors. And so just to recognize that and to approach it in a little bit of a different way. So that was a great thing that you mentioned.
So I just want to give Carrie a chance to, after listening to this conversation, if there were thoughts or questions that came up for you, Carrie, that you feel like you would like to weigh in on.
Oh, thanks, Raquel. I've just been taking a lot of notes, and I'm seeing new friends I have to connect with after this this call. So I just more thank you. I think you did a great job covering an expansive list of topics, and look forward to getting to know folks better. So thank you.
Great. Okay, so I'm just going to try and see if I can do one more round of questions before I close it out. Hard to know where to go, but I guess my question is really from a mental health standpoint. Are we starting to see, given some of the points that Dr. Roche has raised, are we starting to see kind of new forms of mental health counseling, community-based counseling, new ways of thinking about behavioral health, wellness, and services, new ways of structuring services that we think not only will be adaptive to the epidemic, but will actually begin to think about a more attuned to the racial issues and economic issues that many of our families are facing.
I'll just speak quickly to that. I'm sure Dr. Park has more to add, but I know, like I said, I think, racism has always been an adverse childhood experience. And I think now it's coming to the forefront of discussions, which probably should have happened a while ago, but it is now at the forefront of discussion. So we are trying to adapt a form of trauma-informed care approach to our patients. So front to back, everyone from when a patient enters our facility, where I'm at a federally qualified health center in New Brunswick. So anyone from when a patient encounters our security guard, our front desk registration person, to our secretaries, to our nurses, to our providers, that really we have a learned trauma-informed approach to every single person that walks through this door, and giving that sense of kind of like basically trying to find out more what's going on, and not just, being that accusatory, why are you 20 minutes late for your appointment? Instead of just yelling or scolding them, it's important to find out why. Like, did they, they had no transportation, they're taking care of another child who may be sick. So just kind of having that all well-rounded approach to each child, I think, is a really important thing. And I think, as I mentioned before, being proactive as opposed to reactive. I think a lot of times we're approaching things as a system from a very reactive approach. And I think that's what's going on right now, in form of the racism. So that we're being reactive. And I think being proactive is really important, that we kind of approach these a little bit more really explicitly and more intentionally. And I think that would be my thought on that.
Mm-hmm.
Thank you. Dr.
I agree that the trauma-informed care is imperative, because you could have every opportunity, like you said, from the person you're walking in the front door, there could be an opportunity for re-traumatization of these children, youth, families. The sanctuary model of trauma-informed care is a great one to follow. But it's, in thinking about, it may not take a whole lot of time, but just in even saying to children or youth or parents who come in, not just, how are you doing today? A lot of times you can just ask them, how are you feeling today? And what's on your mind? What has been the most difficult part of your day today? What's been a challenge for you today? And then you open up these conversations where you can start, we just need to start to open up those conversations so that we can normalize feelings, we can validate feelings. And also, at Cooper, we're starting to sort of infiltrate into outpatient care offices, which is nice, in behavioral medicine. So we've kind of solely been in the hospital for a while, and getting into those pediatric environments, getting into OB clinics, getting into places where we can have those warm handoffs from physicians, and then meet with those patients on an short-term basis or longer term if need be.
Thank you. Dr. Roche, last word.
Right through now, this is a, stressful time. Things are so, have taken such a turn that we just have to work hard to make sure we keep COVID in the forefront of what people are talking about, because what we've seen lately is such that this is enough to, essentially turn some of the attention away from what we're trying to do in terms of this healthcare epidemic. And we have to keep on bringing the conversation back. The issue about what we're going to do about structural racism, which, is so pervasive, in every level of society, we can try to retrain the workforce, but we also have to reinvent the workforce so that people actually have people who understand that culture and come from the culture actually take care of them. So I'll just quote Dean Johnson, who's the dean of both, the Newark Medical School, is also at Robert Wood, to talk about the endangered Black male within medicine who's being driven completely out of medicine. I went to medical school in 1976, and there were less Black men in medical school than when I went there in the 70s. So the reality is that, there's some basic issues that have to be taken care of, but they all come back to the same issue about, the unfortunate reality of, white privilege and white supremacy, and it pervades the entire society. So it's hard for us to fix one little thing, but everyone has to strive to do so. And our COVID epidemic is just another representation of the same. So we're going to all have to teach and learn to improve what's going on in the world. But this is a very stressful time for people, regardless of what their race and ethnicity is. But there's certain groups, particularly the people who are in the impoverished, regardless of their race, and particularly for all minority people in the United States, under a lot of pressure. And we're going to all have to always keep that in mind, because we're going to see behavioral issues escalate even in every place that we function, and particularly in the healthcare system, a place where people have to come, whether they feel comfortable or not. And we're all going to have to be sensitive to that and learn the art of de-escalation, and also a sympathetic approach, understanding all the things that are happening in the world around us.
Thank you so much, Dr. Roche. And thank you, all of you. What an incredible conversation, obviously, to be continued. I want to thank you all for attending and participating. The session has been recorded and will be distributed after the call and made available on our next Project ECHO, on our New Jersey Project ECHO COVID-19 webpage, along with the resources. We would like your feedback, so please do take a few minutes to complete our post-session survey and share your interests for the upcoming sessions. This will be our last MCH COVID-19 session as we wrap up the MCH COVID special webinar series. And Rutgers New Jersey Project ECHO will be launching the MCH OUD ECHO curriculum starting next week, Monday, June 15th. We'll still be talking about COVID, but kind of in more of a case, using the case-based learning platform that really ECHO was designed for. So the first MCH ECHO will be on the social determinants of maternal and child health. Participants who attend the regular ECHOs will be able to claim and receive CEUs. Project ECHO is hosting various ECHOs, so please do visit our Rutgers Project ECHO webpage for more information and registration. And thank you all, and be well.